Today, inshallah, we are going to study the most common and essential investigations in the field of hematology. There are many investigations, but the essential ones are the complete blood count, also known as CBC commonly, and included in it the red cell indices, the peripheral blood film smear, together with the complete blood cell count. Peripheral blood smear shows or acts as the mirror of the human being. Most of the diseases can be diagnosed just by looking to the complete blood count and the peripheral blood film smear. Then the bone marrow aspiration and trivine biopsy, which has certain indications. Immunophenotyping, which is the study of the characteristic antigenic determinants using antibodies, which can be done also by different techniques, one of which is the flow cytometry, in which fluorescent dye are used to show the antibodies, and the bleeding profile in a patient presenting with a bleeding disorder. Any increase in one of these leukocytes is called leukocytosis, and decrease in the measure or count is called leukopenia. Leukocytosis can be neutrophilia, eosinophilia, lymphocytosis, monocytosis, the different leukocytes types. Leukopenia also can be called neutropenia, low level or count of neutrophils, and so on. The abnormal cells can be due to an infectious agent like Epstein-Barr virus, which causes atypical lymphocytes. The white blood count also shows the abnormal or neoplastic cells, which is called leukemia. The complete blood count also shows the platelets, which can increase in number, called thrombocytosis, or decreased in number, naming thrombocytopenia. These are the main components of the blood, the cellular component of the blood. These are the leukocytes. The red cell indices are the mean cell volume, the mean cell hemoglobin, which is a measurement of the hemoglobin content of the hemoglobin, individual erythrocyte, the mean cell hemoglobin concentration, which is the measurement of the hemoglobin content of all the erythrocytes, and it is calculated. These are the normal reference values. Mean cell volume, the volume of the red cell, is the average one is 80 to 96 femtoliter. The mean cell hemoglobin is 27 to 33 picograms, and the mean cell hemoglobin concentration 33 to 36 grams per deciliter. Red cell distribution width is also one of the indices, and the normal reference value is 12 to 13.6%. Any abnormal measurement of red cell indices has its own meaning. For example, in this patient who is complaining of fatigability, pallor, light jaundice, and finger numbness, the mean cell volume is 117.6, and this is a high MCV. In this case, this is called macrocytosis. Macrocytosis, large cell volume. And the mean cell hemoglobin will also increase 39.6. It is elevated. Then there is increased concentration of the hemoglobin per each erythrocyte, while the red blood cell is low and there is basophilia. This picture is seen in a patient with liver disorder. So the CBC reflects the systemic diseases as well. The second investigation is the peripheral blood smear, which is done by a needle stick at the thumb, from the thumb commonly for adults, or can be from the heel in children, then smeared in a slide and stained with a specialist. This is the normal appearance of the peripheral blood. It contains the majority brown one are the red blood cells. The red blood cell usually has a central color that do not increase 1/3 of its size. These are the leukocytes. This is the band neutrophil and this is the segmented neutrophil. And these are the platelets. They are very small. This peripheral blood film is abnormal. The red blood cells are slightly decreased in size and have a paler center larger than 1/3 of its size. This is iron deficiency anemia. The red blood cells in this peripheral film are elongated, taking the shape of the pencil, and this is a characteristic feature of iron deficiency anemia. In this peripheral blood film, there is a hypersegmented neutrophil. The neutrophil has only 3 nuclei. These are hypersegmentation or 3 segments. This neutrophil contains more than 6 segments. This is hypersegmented neutrophil, usually seen in megaloblastic anemia. You know that is you can see also the red blood cells are larger than normal. Megaloblastic, big red. This is also a hypersegmented neutrophil, and the cells are large and in sometimes oval. This is a case of pernicious anemia. The red blood cells here are rounded. This is called hereditary spherocytosis, which is an inherited disorder of the cell membrane of the red blood cell. These red cells are elongated and sharp. These are sickle cells, one of the hemoglobinopathies. Sickle cell also elongated and curved sickle cells. As we see here, these red blood cells contain ring stage of the malaria, falciparum malaria. So the peripheral blood film shows many disorders or diseases in the human being. not only disorders of the red blood cells, but also the platelets. In this case, there are multiple platelets aggregated together in one place, and this is a disorder of function. In this case, there are large platelets, and this is also an inherited disorder that contains giant platelets. Bone marrow aspiration is an invasive procedure done for certain indications, done for cases of cytopenia. Here we mean pancytopenia, when there are low hemoglobin red blood cell counts, low white blood cell counts, and low platelet count. It can also be indicated to diagnose leukemia, particularly acute leukemias, because one of the definitions or the diagnostic criteria of leukemia is the infiltration of the bone marrow by blast in more than 30% of the bone marrow. Lymphoma staging, the staging of lymphoma. Lymphoma is diagnosed by lymph node biopsy, but one of the staging criteria is the involvement of bone marrow. Myeloproliferative disorders, which one of which is chronic myeloid leukemia, a chronic disorder, or myelofibrosis. They cause fibrosis in the bone marrow. Also, it is indicated when there is a fever of unknown origin. It may show, for example, leishmania in bone marrow. This is the normal appearance of a bone marrow aspirate in an adult middle-aged man. It is 50% cellularity. These are the cells, and the white large circles are adipocytes. Okay? The large cells seen here are the megakaryocytes, producing the platelets, the precursors that produce platelets. Contains the red cell precursors and the white cell precursors. And these are the megakaryocytes, the largest cells in the bone marrow. This is the bone marrow in a patient with aplastic anemia. Bone marrow trifine is done to show why, in cases of pancytopenia, for example, to diagnose or to know why the bone marrow, the factory that produces the hematopoietic cell, is not working. Is it because of the failure of the stem cell proliferation, aplastic anemia, or because of replacement with a neoplastic disorder or neoplastic cells? This is a case of aplastic anemia, failure, and this is a case of leukemia. The bone marrow is replaced by abnormal cells. Immunophenotyping, which is a process of detecting the phenotypic appearance of the cells or the types of the cells using antibodies. These antibodies can be labeled by fluorescent dye, and this is called fluorocytometry, or by chromogenic dyes like immunoperoxidase, and this is immunohistochemistry. We will discuss only on commonly used technique in hematology is the flow cytometry, which is an immunophenotyping technique in which suspensions of living cells are stained with specific fluorescently labeled antibodies and then analyzed with the flow cytometer. The sample can be a blood or a bone marrow aspirate or a lymph node suspension. Okay, while in immunohistochemistry, the sample is formalin fixed paraffin embedded to shock block. This is a, a web-based image for a flow cytometry machine, and this is the same machine here in Khartoum Oncology Hospital, مستشفى الذرة. The results are shown in different colors. For example, this apparatus uses the granulocytes, red for granulocytes, the green for monocytes, and the lymphocytes. It diagnoses different diseases, mainly leukemias. In this case, these cells are shown here expressing the CD19, CD cluster of differentiation. CD19 and CD20 are B cell markers. So these are B lymphocytes, and also expressing CD5. So this is a CLL, chronic lymphocytic leukemia. In this example, besides the small number of lymphocytes, there are a lot of myeloblasts expressing CD45, which is the leukocyte common antigen. So this is acute myeloblastic leukemia. Bleeding profile, the investigations done for a patient presenting with bleeding are also. We start here also with the CBC and platelet. The CBC should be the first investigation for all patients. Then the bleeding time, the platelet function test, the venous clotting time, the prothrombin time, and the partial thromboplastin time. If the CBC shows a platelet count less than 20,000, this means that this patient may bleed spontaneously, and there should be a serious and immediate intervention by giving platelet transfusion. 20 to 50%, 50,000 platelets, the patient can bleed after a minor trauma, while if more than 50%, the bleeding can occur only after a major trauma. In the CBC, if you see no platelet, that means the patient is thrombocytopenic. The patient has low platelet count, and also in this case, he can bleed. You see in the peripheral blood film a lot of platelets aggregating. That means there is an abnormal function of the platelets. Also can present with bleeding. Giant platelets also indicate a hereditary disorder or bleeding disorder. Bleeding time reflects the platelet function, and it is normally 2 to 7 minutes. The venous clotting time is normally about 5 to 20 minutes. It is prolonged if the clotting factor is less than 5%. The small clot, if there is a small clot, that means there is hypofibrinogenemia. The fibrinogen level is low. If the clot retraction time is abnormal, this is also a disorder of platelet function. There is also a test called clot lysis time. You know, or you may come to know that there is a coagulation pathway, which is composed of intrinsic pathway, and a common pathway. The prothrombin time tests the extrinsic pathway and the common pathway. The extrinsic pathway is composed of factor 7 mainly. Then it joins the common pathway starting with factor 10. So abnormal prothrombin time indicates that factor 7, there is a disorder in factor 7. And the partial thromboplastin time reflects a disorder in the intrinsic pathway or the common pathway. The intrinsic pathway contains factor 12, factor 11, factor 9, and factor 8. Then it joins factor 10 to the common pathway. So patients with disorders in factor 8, which is called hemophilia, or 9, hemophilia B, has or have a prolonged partial thromboplastin time. The thrombin time reflects a disorder in the thrombin, which is factor 2, that converts the fibrinogen into fibrin that makes or stabilize the clot. The prothrombin time normally is 11 to 14, around 11 to 14 seconds. There is a ratio called prothrombin ratio, and there is a standardization of the prothrombin time called the international normalized ratio. It is calculated using the patient prothrombin time and the control sample prothrombin time to the power of the International Sensitivity Index. It is commonly used to control the bleeding, the clotting and bleeding functions within in patients with platelet disorders or patients using antithrombolytic agents, like patients with artificial valves. The partial thromboplastin time is about 34 to 48 seconds. If there is only prolonged partial thromboplastin time, that means the patient has either factor 8, factor 11, or factor 9, or factor 11, or factor 12 deficiency, or has inhibitor to factor 8, or 11, or 9, or has antiphospholipid syndrome, which is common in females with antibodies to antiphospholipid antibodies. Okay. To confirm that there is a deficiency in these factors, holding mixing test is done, in which the patient plasma is measured. The partial thromboplastin time is measured in the patient plasma at 0 hour, then mixed with the normal plasma, and after 2 hours, the partial thromboplastin time is measured again. If it is corrected, that means there is a factor deficiency, one of these factors. Then a specific test for the measurement of each factor is done. To summarize, we discussed that the complete blood count and red cell indices together with the peripheral blood smear are very important and essential investigations should be done for all patients, and they reflect a lot of diseases. Bone marrow aspiration is indicated in certain times or conditions, and also the trivine biopsy. The immunophenotyping using flow cytometry, in which the fluorescent dye is used to show the antibodies directed to the specific antigens in the cell membrane of the cells, different cell types, usually the white cell types, is used in hematology to diagnose leukemias particularly. Bleeding profile contains the bleeding time, the clotting time, the partial thromboplastin time, and the prothrombin time. Very much. I hope that you gain something new. Assalamu alaikum wa rahmatullah wa barakatuh.